from the News Channel 5 network. This is Medical Mondays.
From Baptist Hospital, please welcome Dr. David Moore. He is an orthopedic surgeon, I should mention, and you, if you don't mind, Dr. Moore, tell us exactly what your specialty is and what you do over at Baptist.
So I am an orthopedic surgeon. I did my 4 years of med school and 5 years of residency, and then actually subspecialized in sports medicine. So I spent an extra year of my life down in Birmingham kind of learning how to do all the fancy arthroscopic knee, shoulder, and elbow operations and taking care of people that largely have sports-related injuries.
All right. Now we see for Baptist Hospital all those billboards with Jeff Fisher. We know that they're connected to the Titans and help the guys out a lot. But you really, I mean, all of you gentlemen really work on a lot of athletes.
We do, and obviously the high-level athletes, our collegiate athletes, and our professional athletes are actually a very small number of the total people that we take care of. Typically we see lots and lots of grade school, high school kids, and then certainly a lot of people that are kind of our weekend warriors that are 35, 45, 55 and up that are still out there being very, very active.
Yes, and pushing it a little bit maybe when they shouldn't be. Who knows?
And oftentimes a lot, yes.
All right, yeah, those are the guys you see out maybe at Centennial Park playing and all of a sudden someone's coming to visit you on Monday. Well, specifically when we talk about certain injuries, when dealing with sports, what's the most common type that you all see and treat in your office?
I think you touched on it earlier in the intro. They would either be sprains or strains. So typically when we talk about someone having a strain, it's that they've actually extended a muscle beyond its capacity so that it's lengthened perhaps more than it should have. That's when you're running and all of a sudden you pull up lame, your hamstring hurts. Or sprains, which would actually be an injury to a ligament around your joint, which there are actually several different degrees of sprains, but essentially it's just a gradual stretching of, or sometimes a very sudden stretching to a ligament around a joint.
It's a lot of muscles that we don't usually typically work out on a daily basis, obviously. When that kind of thing happens, how long should I be waiting before I pick up the phone and say, I need some help?
I think most people are very good about it. They'll wait 2, 3, 4 days, and if things just haven't gotten better, then they'll start looking at calling someone. There are some things that happen when you know, hey, something really bad just happened either to my knee or my shoulder, and you should certainly go see somebody sooner if that happens. But if it's just kind of a general ache and pain, usually 3 to 5 days, and if it hasn't gotten better with rest, ice, elevation, probably worth giving someone a call.
Yeah, and those are always the proper things to do, is rest and elevate whatever body part, put some ice on a cold compress. Maybe, I don't know if you guys do warm compresses too, depending on the injury.
Usually ice is better, certainly in the first 2 to 3 days. Heat tends to increase blood supply and actually increases a little bit of the swelling around the joint and can oftentimes make things hurt a little bit more. So typically ice for the first few days. Sometimes we will add a little heat a little bit further down the road, but that's usually for more specific injuries.
Okay, on the outside of whatever is bothering you, should you be looking for certain kind of symptoms, whether it be a bruising or a swelling or something that just doesn't seem right? Absolutely.
If you feel a big pop or a big pull around a joint and you notice a significant amount of swelling or a lot of bruising, I certainly would go see someone sooner than later.
Yeah, because the ibuprofen's not going to last, right?
No, it will not.
And I guess that's something that maybe people can go ahead and do in the meantime.
Absolutely. I would certainly get started with all of that, and if you think it's a more serious injury, certainly don't hesitate to go to the emergency department, or if it's something you think you can make it overnight, then just give us a call the next day.